our study was entitled Relevance of Maintaining a Proper Ethical and Social Approach of the Community Towards Health Workers of Primary Healthcare Units of Carrascal, Surigao del Sur amidst pandemic. In many low and middle-income countries, community health workers are an important part of the primary healthcare workforce. Despite the fact that Carrascal was an early user of the community health worker model for primary healthcare delivery, initiating the barangay health worker programs in the early 2000s, little is known about the variables that inspire and sustain barangay health workers, primarily voluntary commitment. By analyzing the life experiences and roles of barangay health workers in both urban and rural settings in the Philippines, this study intends to close this gap. The purpose of this study is to fill that vacuum by documenting the experiences and functions of barangay health workers in various urban and rural settings in the Philippines. We take Campbell and Cornish approach, which emphasizes relational and material aspects of the social context of participation in order to better understand the facilitators of community mobilization for health improvement. This aids in identifying contextual elements that impede or support community members' motivation to participate in barangay health worker program and maintain their involvement over time, which are often overlooked in the literature. The findings of this study could inform task shifting, programs and policies that seek to empower and mobilize community to take more control over their health through community health workers, both in the Philippines and in other workforce, as many barangays in Carrascal are in the process of implementing new community health workers programs or strengthening existing ones.
Statement of the problem. This research on the relevance of maintaining a proper ethical and social approach to the community towards the healthcare of primary healthcare system of Carrascal, Surigao del Sur amidst the pandemic aim to answer the following statement. Number 1. What are the ethical and unethical approach of the community towards the healthcare worker of the community? Number 2. How did the healthcare worker respond to the unethical approach of the people towards them? Number 3. What are the program and action taken by the local government unit in order to maintain a proper social and ethical approach to the community towards the healthcare worker?
Result and analysis. In the first table, out of 50 respondents, there are 27 or 54% who strongly agree in the first statement that says the community follows the protocol disseminated by the RHO. In the second statement, 25 or 50% out of 50 respondents who strongly agree that the resident of the town acts attentively during the RHO visitation in their barangay or home. The third statement, there are 33 respondents or 66% strongly agree that the town people shows respect to health workers whenever they encounter them. In the fourth statement, out of 50 respondents, there are 28 or 56% who strongly agree that during every vaccination session, the residents follow the instruction obediently that were given to them. And fifth statement, 31 or 62% respondent who strongly agree that whenever the resident visited the healthcare facilities of Carrascal, they always followed the hospital rules as imposed by the RHO.
Table 2 out of 50 respondents, 46 or 92% checked the fourth column or informed them about discourteous behavior in a professional way. In a situation if a resident doesn't follow the protocols disseminated by the RHU, the resident will receive a high disciplinary action, what they deserve. In the second situation, if a resident of the town doesn't act attentively or accordingly during the RHU visitation in their barangays or home, there are 46 or 92% respondents check the fourth column or inform them about discourteous behavior in a professional way. Third situation, if people in the town show disrespectful act towards health workers whenever they encounter, 41 or 82% respondent who check the fourth column. That means inform them about discourteous behavior in a professional way. In the fourth situation of if resident doesn't follow vaccination instruction obediently that were given them during every vaccination session, 37 or 74% respondents checked the fourth column. That means inform them about discourteous behavior in a professional way. And the last or fifth situation, if resident disobey the follow the hospital rule as imposed by the RHU, whenever resident visited healthcare facilities of Karskal, there are 38 or 76% respondent who checked the fourth column or informed them about discourteous behavior in a professional way.
As shown on the last table, 50 out of 50 respondents wants the government to implement the orientation program for proper ethics toward RHO during pandemic. 46 or 92% respond for the implementation of RHO community approach. 48 or 96 responded the barangay visitation. 46 or 92% have responded the moral-based symposium empowering proper morally towards medical field staff during pandemic. And lastly, for the implementation of regular assembly for ethnic enhancement, there are 47 or 94% responded.
The primary purpose of this study was to examine the relevance of maintaining a proper ethical and social approach of the community towards health workers of primary health care units of Karskal regarding SOR amidst pandemic. The data that was gathered by letting the specific group of respondents answer our survey shows significant information and details that we needed for the fulfillment of this research. On the first statement of the problem, which is about the ethical and unethical approach of the community towards the healthcare workers of the municipality, it was answered in the test 1. The result shows that the town people of the Karskal or the residents acts in a proper ethical way towards interacting with the health workers. Most respondents answered that they agree that the people
For the second statement of the problem, it is regarding on how did the health workers respond to the unethical approach of the people towards them, and was based on test 2. The data gathered had shown that whenever health workers encountered rude, disobedient, or offensive residents, the thing that they will do is not to report it to the police, IATF task force, or chief, or the hospital, but instead they will inform the resident in a professional way on how discourteous they are toward health workers. The last statement of the problem was accorded to test 2 that talks about the possible programs that the government should implement to prevent rude behavior of the town people of interacting towards health workers. The data revealed that the two most voted programs that the health workers wanted to be implemented and are orientation program for the proper ethics towards RHU during pandemic and barangay visitation, which mainly has a goal of informing residents about the etiquettes that they must possess every time they will encounter health workers.